Hi, this is Matt Giesecke. I've got Jen Courtois and Brecken Anderson, our wonderful nurses here at GMS. We're going to talk about all things vaccinations. Everyone knows your vaccination records are due into Human Resources by September 1st. We've got some leeway with the flu shot as those are just now coming out. We'll talk a lot about the flu shot today. But I've got the nurses here to answer some questions about flu shots because I know there's a lot of concerns, particularly about that vaccination along with the COVID-19. And we will be holding a Q&A session a little later this month for those who want to ask the nurses questions themselves. Hi, Jen and Brecken.
Hi.
Hi.
All right, I've got some questions for you. We'll start with you, Brecken. Why get the flu vaccination?
Well, getting the flu vaccine saves lives. Hundreds of thousands of individuals are hospitalized each year with influenza, and some can suffer some very serious complications: dehydration, bacterial pneumonia, even sinus infections. So we want to protect ourselves, protect our families, protect the ones we work with.
Okay, great. Jen, a lot of people are concerned about getting sick from the flu shot. Will I get sick from getting the flu vaccination?
So the flu vaccination does not give you the flu. And there's always the chances of having some mild side effects from the flu vaccine. Usually those are not very serious. Could be headache. You might feel a little achy after having your shot, but it shouldn't last more than a day or so. They're usually very mild. So you don't get sick from the flu shot. You also, it takes a couple of weeks before you build up immunity for the flu. So, we still need to remember to wear our personal protective equipment while we're at work, which is mandated. And that when you're in the community, it's highly advised that if you're indoors, you wear a mask. So that's what's protected a lot of people from getting the actual influenza the previous year that we've gone through with COVID.
And Brecken, I know we're hosting a flu vaccination clinic on August 21st. It's going to be all day here, I think 9 to 3 at the main office. When's a good time to get the flu shot? When should I get the flu shot?
The CDC is recommending that we get our flu shots as soon as possible, as soon as we can. And the flu clinic is going to be here August 31st from 8 to 4, and your supervisors will have information for you to sign up for that if you'd like to. The flu vaccine, you can also get at any pharmacy. You can get it at Walmart, Walgreens, Rite Aids, and they're free of cost to you. All you have to do is submit a copy of your insurance card, and if you do not have insurance, they still have options for free influenza shots. So as soon as possible, the CDC is recommending get out there and get your flu vaccination.
And Jen, do healthcare workers need flu shots, and are DSPs considered healthcare workers?
Yes, they are. They're vital for our workforce. And so it is recommended that everybody receive their flu shot by October 15th. That's why we're having our initial one early, and then we'll have hopefully another flu shot coming up soon after that. You're also not only protecting yourself, but you're protecting those that you're taking care of, whom also will be getting the flu vaccine. So they're helping to protect you, but we need to all take care of each other. It does help really with the people that we service because many of them are immunocompromised, so that, we need to just be there to protect each other.
So, Jen, other than healthcare workers, who else should receive the flu shot?
It is recommended for anyone ages 6 months and up. Ages 6 months, the children from 6 to 8 would be given 2 small doses of the vaccine on different occasions. But those are the folks that I am concerned about, especially with the Delta variant that we have going on now, because they currently are not eligible to have the COVID vaccine. So it gives them, significant protection. And everybody else over the age of 8, it would be a single dose of the influenza. And it is the, what they do is they look at what the previous years have been, and from that, they usually have 3 to 4 viruses that are combined in the vaccine to give you the most protection that we can.
There's also a vaccine for 65 and older that protects those individuals because they need a little bit of a stronger vaccine to help protect those. So there is a stronger vaccine for those 65 and older, and we do have those available at our clinic on site in August, on August 31st.
All right, we talked a lot about the flu vaccination. Is it too late to receive the COVID-19 vaccination, Brecken?
No way. Get your vaccine as soon as you can. We know the Delta variant's out there and it's strong. So if you haven't received your COVID vaccine now, today is a good time to get one.
All right, great. Thank you, Brecken and Jen, for your time. I know you're about to do a CRMA class. Thank you for taking the time to do this for us. And we'll see them shortly. We're going to announce the time for another town hall for discussion on vaccines very, very, very soon. Thank you, everyone.